recognize most of you because you were in my class last year for assessment. Welcome back. I'm glad you made it this far. You're on the road to good things. And you will make it even further. So this is on school nursing, and I was a school nurse. It was one of my favorite jobs I've had over time for I think I did that for 7 or 8 years. I worked mostly in a primary school. However, I also did work with the school-based health center at Maranacook for a long time. I was actually on the board when it first was in the development stage. So it's a really important piece of health for the adolescent as well as the primary students. So I have a fair amount of experience working with all age groups. But the school nurse, as Ellie had mentioned, really encompasses quite a bit. Next semester, you will probably be in, I don't know what your schedules are. I know people have kind of mixed up their classes. Community health in 301. School nurse is part of community health. And you'll see from some of the links that I have up here that when you have community health, you can go through these links too and say, okay, these are the health determinants that the school nurse actually works with. The PowerPoints will be available. I have given them to Erin Voisin for Peds to post on the Peds site, and also to Jen, I don't know her last name, the new person, Blakey, to post on OB. Does anybody not have Peds or OB that would need this some other way? Okay, so this PowerPoint will be available for you. You are not being tested on it, but it is something that I hope you keep in mind when you go to your school nurse experience and not, think that you don't know anything when you go there. So really, and then to be able to see what the school nurse does and realizes where it fits in the whole spectrum of school nursing. Has anybody gone to school nursing yet? Okay, so you can add to our presentation on what you saw and what you did and some of the roles of the school nurse. And you won't see every single role of the school nurse in like your day or two that you spend with the school nursing, but it's quite, I would not recommend as a new grad to go into school nursing because it takes a lot of independence and confidence and a background knowledge base, as you will see how many different hats you have to wear as a school nurse. But it's definitely something that is, it's dear to my heart, and it really makes a big impact on our future generations. So, all right, this is supposed to go when I click the button. Next. Hope I don't have to do that the whole time. All right, so this is the most common definition of school nursing. It's from the National Association of School Nurses. That's a great website. They've improved it every year, and I have some links here for you to refer back to, not to memorize. It's a specialized practice of nursing, protects and promotes student health, facilitates development of students as they grow, and advances academic success. If it wasn't for school nursing, our students may be at a risk for failure and not be as successful in school, in addition to, of course, the teachers and other services that they have offered at the school. We are ethical, and we do use evidence-based practice. School nurses do research, and we do a lot of data collection, and we report a lot of that to the state. And a lot of the campaigns, like with obesity and everything like that and staying fit, have been based on school nurse data collection and the asthma rates of kids. All of that is very important for the school nurse to collect. We are leaders. We bridge healthcare and education, provide care coordination, advocate for quality student-centered care, as you'll see in the model. We collaborate with other systems and allow individuals and communities to develop their full potential. So it's a very community-based also. And if you want to know more about that, you can click on that link when you get the handout. What does school nursing mean to you? What knowledge do you need? What do you think you need to know to be a school nurse? Anybody who's been in school nursing so far? What? Okay, so you need to know a bit about acute illness. You need to know a bit about chronic illness. What else might you need to know? About abuse, yes, and I have a handout on that. We won't go through the checkoff, but today, because it's not a class on child abuse, but I wanted you to have that. Abuse can come in many different types of forms, and I was doing a class on that at one point, but I don't know where that fits in your curriculum. Hopefully in your psych class you'll get that. What kind of skill sets do you need? One of them I taught you.
Assessment.
Assessment, yes. Good answer. Assessment is very, very important. So if you don't have your assessment skills, you probably aren't going to be a very good school nurse. Kids come into your office. Monday mornings are really busy because it's like, oh yeah, whatever happened over the weekend, Mom says for me to come and show you. Like this one kid had this gooey stuff in his ear. He wanted me, Mom said, it'll take a look in my ear. So I'm like, all right. So you talk to the kid, you get a history, you find out what's been going on. Oh yeah, I'm making chocolate chip cookies this weekend. Guess what he put in his ear? I wasn't supposed to eat them, so I put one in my ear for later, and what does it do? It melts. So Mom freaks out and sends her to the school nurse. So sometimes there's kind of, comical of what you see, but there's also lots of rashes and things that, like, gosh, I didn't know I needed to be a dermatologist to be a school nurse, but that was one thing that I felt a little bit more inadequate about. So my dermatology skills have increased since I was in school nursing. So you are, in many ways, the primary first person that the child or adolescent will go to see, rather than Mom spending money and taking time off of work to take you to the doctors. So the school nurse is very important. And it's also important to have our eyes, our ears, and everything open to assess a student. Gee, they're not quite like they were last week, or what's going on with you. We added 3- and 4-year-olds into my school at one point, and I was like, oh my gosh, did my workload increase dramatically? Because everybody misses Mommy at that age, and they were riding the school bus, kind of a scary thing. So I made a deal. All these kids kept coming into my office with tummy aches. So I figured, okay, you know what? I think they just need a hug, and you're supposed to hug, but so we made a deal. They would come and stop in and say hi to me in the morning, and then they would have a better day. You greet them off the bus, do things like that to make them feel more comfortable in the school setting. So a lot of the skill sets you need are assessment. That's probably your number one. And then if you find something unusual, then you go look it up. Med-surg really comes into play. Acute illness, chronic illness. There's a sign-in sheet and there's some handouts going around here too. Who does a school nurse interact with? Especially with those who've been in school nursing to this point. Who do we work with? Who's important for us to get to know and to collaborate with in the school system? The principal, the teachers, the parents, definitely, the family members, the siblings. Siblings tell you everything. Sometimes they tell you as too much, that you need to report it. Sometimes siblings tell you things and the mad father finds out and comes and starts slamming things on the desk, and you hide behind the principal because he's really angry that you don't need to know about that. So you have a lot of different dynamics happening in the school system that are important to be aware of. You want to also collaborate with the guidance counselors if you have that, and speech therapists, anything that physically could be wrong with a child or mentally, emotionally. So it's all aspects of the student that we actually look at. We also do collaborate with curriculum. There's a school health-based curriculum. I didn't know if you knew that, but there was a grant when I was working as a school nurse to put a health-based curriculum into the school system, and the school nurse was one of the major players in that. So you work with developing curriculum, you work with dental hygiene, you work with the state oral health program. They have a lot of free stuff. You learn how to access lots of free materials because school nurses are poor. They don't get paid well. The school's usually poor, so you have to find resources. So you really collaborate with the state systems, the DHS, the school oral health program. You collaborate with all the teachers on all of the services, the physical therapists, occupational therapists, the reading teachers, the phys ed teachers a lot. I did a lot with phys ed because what's important now is recess for kids with ADD, ADHD, that they find that recess is one of the most important things to keep in the school system. So why not have after breakfast, when lots of kids have breakfast at school now, have a little run around the gym before they start class. That really helps to calm them down. So the school nurse can be instrumental in suggesting a lot of those things. We did a lot with tobacco education, integrated it into the entire curriculum, and even when tobacco and the Native Americans and everything. So there's a lot you can do. It was a very fulfilling job because there's just so many aspects of it. So you interact with pretty much everybody. You also interact with the community because you're a disaster, for disaster drills, for gun violence and safety. You have to interact with the police department. You have to know how environmentally about the building, about mold and mildew, and about disaster planning. What are you going to do? The school nurse is integral in that planning. So you are part of a team working with the community in addition to taking care of the kids in the school system. You also are the go-to person for the teachers and the bus drivers when they have a headache or something. You know, they go see the school nurse too. So really, I diagnosed one teacher, unfortunately, with multiple sclerosis because they were looking at her for like carpal tunnel and like, no, you need to go see a neurologist because of what you've told me. I'm not going to tell you you have MS, but that's what she ended up having. Wow. Because it wasn't my job to tell her, but it was my job to refer her, based on the knowledge I had, to refer her to the appropriate resources. She's doing really well, by the way, so it was a good thing that she got on medication and all. This is from the National Association of School Nurses, just some assumptions about promoting well-being and academic success and lifelong health, lifelong achievement with students. It's very dynamic. We're leaders in the school health program. The school nurses are usually, the mandatory ratio for school nursing is 700 to 1. 700 students to 1 school nurse. Now you think of all the meds that these students have to get, day to day, I mean just plain old meds. So you have to learn how to delegate, you have to write policies, you have to do make sure it's safely given and that it's given in because you can't be there for 700 students, it's like an impossibility. So that's why you see a school nurse has like 3 or 4 different schools that they bounce around to. They do the mandatory assessments that are due for the state. And then hopefully, they have a phone or something that they're called in for crises. So sometimes it's crisis management is all they have a chance to do. But if you have I actually wrote some grants, so I actually had paid myself to have more time in the school on purpose because it was important for me to be around a little bit more. And we definitely use critical thinking. And you're not going to get away from those care plans. You write care plans? I like care plans. I know you don't do as many as we used to have students do all the time, like every week, and every patient. But it teaches you how to think. It's a process to teach you how to think. You write care plans on your students, especially the ones with acute illnesses. Somebody who's like, I'll say normal, even though normal is not a word, right? Remember that? Normal is not a word. Everybody gets a care plan, but there are certain students who have more detailed care plans than others, and they are involved with individual educational plans, and the school nurse is also part of that team. So you have to still understand your nursing process, which keeps you organized, and it is part of the public health and community health. So care this is Susan Hassmiller, is the Robert Wood Johnson Foundation. She's just like an amazing woman, but they have a lot of grant money, which I've been benefiting from over the past years. Care is transforming and shifting as we're sitting here. So what it was like yesterday is not going to be what it's like today. Nurses have to be relevant, so we have to keep up to date all the time. And luckily, the National Association has this wonderful website that they actually updated this year. So you're getting the benefit of 2018 information about school nursing. And this is just their model. Everybody has a framework to go by. So who's in the middle here? Students. So it's student-centered. And it's based on standards of practice that we have. They've been developed over time. It also incorporates community, public health, care coordination, leadership, and quality improvement. So in a nutshell, that is what school nursing is. And we'll go through each of these areas, but these are the 21st century school nursing practice. You have standards of practice, care, and it outlines what each of those are. So we'll just talk about them a little bit. Case management. There's a lot of case management that goes on, and that's with your social worker and your, it could be Head Start people when they first, do they still have Head Start? We get rid of it once in a while, but CDC for early childhood development. So it starts really early when they're first entering into school. Chronic disease management. Ellie mentioned that earlier on, that we do have a mix of students in the school systems. You might be doing NG tubes. You might be having a girl with brand new diabetes that you basically got them to go to the hospital because when you were weighing them on their normal height and weight, they lost 10 pounds over the summer. It was like, I know your family, I know you eat, I know, but this is like not normal. I see you going back and forth to the bathroom all day long, you know, from your classroom. Yes, I know your teacher lets you have water on your table because they weren't into vodka yet, you know. It's like 5th, 4th grade. You don't maybe not do that anymore, but she was drinking a lot, she's going to the bathroom a lot. She came in to see me about tummy aches a lot, ruddy complexion a bit, but you know, it's Maine, it's outdoors a lot. She plays outside. She's on my daughter's little soccer team. What do you think's wrong with her? What do you guess? Diabetes. So check her blood sugar. It's like the machine doesn't work. Call the mother up. Hello. I think she needs to go to the doctor now, like today. Oh, well, she has an appointment next month. I said, no, she needs to go to the hospital. If not, I'm going to take her. Her blood sugar was 700. Whoa. She was in ketoacidosis. So, and she lost her hair because of lack of nutrition. She was very malnourished. This really healthy, you know, great family. You know, you knew she wasn't, you know, deprived of any food. It's just the school nurse is able to pick that kind of thing up. The parents like, oh yeah, she's growing. Oh yes, I know she grew taller, but their height-weight ratio is like way off. So, and she's like really skinny looking. So she was losing weight. So you will see juvenile diabetes in the school systems. That you might be the first, you know, one to diagnose that. So luckily, she got admitted to the hospital and was taken care of, and you know, was then, you know, put on insulin. Then you have to teach. Then you go through and do a lot of teaching, because you're a school nurse with 700 students. You're not there all the time. If you're a small school, you're there part time. So who do you get to do all the insulin and everything? You have to train other people, like ed techs. You have to have helpers come in. You have to write the policy to make sure they're doing it properly. Like all those rights of medication, they have to follow that too. And it goes through the IEP process, individual education plan for those students. So the school nurse is very important with chronic disease management. We collaborate a lot, direct care, give direct care, obviously. They set up a maze where they're having an outdoor festival in the springtime. So somebody brought in, we had a lot of construction workers, brought in one of those tubes, those corrugated tubes, you know, that they put under the road, you know, the plastic things, the drainage pipes. Yeah. Thought it would be, oh, this is really cool to crawl through. Well, guess what? It cuts your knees to pieces. And we had students who needed stitches because it's sharp inside. Nobody, just before they set up, nobody went through it, you know, to see. And I'm getting kids in the office like bleeding and crying. I'm like, take that thing away, because they needed stitches. Because one kid had really gashes in his knees. He was a heavier child, so his weight on the seams of that was really, you know, really cut right into him. So it's direct care, you know, broken ankles, you know, ticks, bug bites, those caterpillars. Don't touch the caterpillars when you go outside and play. Oh, look what I found. You know, they bring it in to show you these pretty little caterpillars that are giving them rashes. Like, oh, well, you tried. You tried to say, please don't touch the caterpillars, so it can make you itch. Oh, but they're so pretty. Kids will be kids. Kids are kids, you know. They're very interesting. Putting up a playground with a lot of wood chips on it. Yeah, a brand new playground. Great, wonderful. Guess what was in the wood chips? Ticks all over the place. So tick problems. So you're, you know, besides bug problems, you got bugs on them too. I never itched more in my life than I did for the years that I was a school nurse. I think I went home and itched, scratched my head, wondering if I had lice and scabies every day. Luckily, I don't know how. I think it's because I have a cold body. I'm always freezing, that the lice don't like me. I certainly found enough lice on kids to, you know, get it from them. But in combing their hair out all the time, you think I would have gotten lice. Luckily, I didn't. I think they like certain temperatures in order to lay their eggs on, and I certainly was a cold one, so they didn't like me. So that, you know, that was probably one of the least favorable things I liked to do as a school nurse was the head checks for lice and scabies. You know, they're little mites that go underneath your skin and they track and they itch like crazy, and the whole family has to be treated. So it's a lot of education. I mean, you can't like send out a notice saying, oh, this person has scabies in your classroom. You have to send it to the whole school saying, we have this in our school. So, this is what we suggest you do. They're not sent home anymore for head lice.
No?
You get to stay in school. No, no, of course not.
My nieces were just sent home for it.
It might be the school policy, but the American Academy of Pediatrics said there's no need to send them home from school for head lice.
Really?
Yeah, really.
That's crazy.
Hopefully they're treated. There's a lot of resistant head lice out there, and mayonnaise actually really like thick mayonnaise or olive oil, the thick stuff, to suffocate the little buggers actually works. So sometimes they'll send out a notice to the whole school, please treat your child's head with this so we can get rid of this because it's starting to become an epidemic. You have 3 or 4 kids in a classroom with head lice, and then it starts going from one place to another. Team sports, talking to the coaches. Do not share those helmets for T-ball, please, because they treat, the whole team gets head lice when they share helmets. So my kids always had their own helmet that they could use. So there's a lot of things that we do for care coordination, interviewing, counseling. The school nurse is a safe person to confide in. They're not the teacher. They're not going to grade them. And they're not the principal who's scary, You don't want to go to the principal. So if you have an issue or concern or somebody's bullying you, they tend to go to the school nurse. So you become a counselor in that manner. You may refer them to the guidance counselor if they're there. They're not there very often either. But the school nurse is really a go-to person because they're that safe place to go. They're more closer to mom than anybody else, I think, in the school because they're not being graded and they're not being looked at. You don't want to tell their teacher. So you learn about abuse. You learn about things that you maybe need to report to the state. You are a mandatory reporter, as any nurse would be when it comes to that. And the police are very good. DHS only looks at, I think they said, 1%? Or followed through. You made a report, but they aren't always followed through on. They take a look at it, and they may not make home visits and stuff. So sometimes it can be frustrating. Then there are a lot of transient students, too, I found, especially in Maine. People come and go. They move. As soon as you catch on to what's going on in the household, they move. They uproot the kids, and off they've gone to Alabama or somewhere else. They just move out. It's really kind of sad. It's one of those heartbreaking jobs, too, because in your heart that school is the safest place for them, and you want to have them as successful as possible and feel like they belong. And you and the teachers may be the only place that they can feel that way. So delegating, I talked about that with medications in particular, because the school nurse is not there every minute. So you have to delegate care to people. You have to train them. You have to teach them. You have to teach the bus drivers about everything. You have to make a list and know who has an EpiPen, who's allergic to this, or what kind of, it's a right to know who needs to know. It's not everybody needs to know, but certain people need to know about the students. Going on field trips, what do? A lot of times if you have a really sick kid, they'll send the nurse on the field trip too. But then what does that do to the rest of the school? The school nurse isn't there because these couple of kids have really bad allergies or need medication, and the school nurse goes with them. So, care plans, student-centered care in transition between elementary school and middle school to high school. You have to carry on those care plans. Now they have electronic records for the most part, which is really nice because you can usually in the same district, they'll have the same type of record. Did you notice that those of you who've gone to school nursing, did the nurse document? Did they have electronic or were they still doing paper? Some places are really small. Kind of both, yeah. Leadership, we are definitely leaders in the field. You might have to get funding and reimbursement. Writing grants, there are a lot of grants out there. The Tobacco-Free Maine grant was one that I got twice. I was told by the principal, yeah, go ahead and write it on your own time. But we never get grants. So we got it twice. And we did this big campaign. I had a singer, I don't know if you remember Color Me Green, a long time ago. It was like, what was his name? It was about the environment. But anyway, I hired him to write songs based on the policies for tobacco education. And we did it from pre-K up through 5th grade. And put on this show, which was amazing. And very few of those students are now, they're older, maybe in high school and college age. Their parents say they're not smokers because they've told me they will never smoke because of that. there was not a lot of material out there for tobacco education until you got into middle school. I'm like, well, what about these third graders who are smoking their father's cigars, you know? They need to learn early, and the resources were not there, so you kind of have to be creative and do your own thing. And it was fun, too. And you're always a lifelong learner. Policy development and implement, so many policies that you have to look at and make sure you follow your policy and the procedures. Even about going outside in the cold or hot heat, because if it's too hot or too cold, you can't send kids outside to play. So those types of policies you might not even think of are part of school nursing responsibilities. Let's see. Access to care. Many students don't have access to dental care, especially if they're Medicaid. There's no, dentists, like the first time you call them, oh, are you on Medicaid? Oh, sorry, we don't take that. So there are not many clinics that are Medicaid eligible. Have you found that with students? They just don't have the tooth care that we need, the oral hygiene, and the oral care is very important. You know, I've seen so many kids with baby bottle mouth when they come in for kindergarten screening. You know, the teeth are kind of rotten down. Well, what difference does it make? They're going to lose them anyway, is what the parents say. But they're like black nubs because they're rotten from going to bed with a bottle of milk in their mouth every night. You know, it's usually a matter of education with that. But oral health is important. And you may not know, but dental hygienists can come in. You can find ones who like to volunteer and do screenings on your kids and do cleanings. And they are willing to do that, you know, free of charge. So, and you can start making referrals. And there are some health clinics around. They're starting to have more of them that will take Medicaid. But then it's an issue of transportation and timing and reminders and stuff, because it usually takes a long time to get into the dentist. Healthy People 2020 is something you will go into depth on in your community health course, so I really won't go into that, but it's has a lot to, it also overlaps with school nursing. Outreach to the population around. With a tobacco education, I also reached out to the community as far as, you know, decrease in the tobacco use and who's smoking in the house, who isn't, kind of did a little research project, and it decreased from 75% down to 30% over the time of the grant. So it was really, I felt it was pretty effective. We had several people. We also had a bin. You could trade your cigarette package for a toy or, you know, or something, I don't know, pens or whatever I had during the show. So if they came in with a pack of cigarettes, they were, you know, got a kind of a nice little prize and put their cigarettes in there. And I know 3 people who have never smoked from that point. One gentleman said to me, my son was playing COPD. How could I possibly smoke now? You know, it shamed him to pieces. This was a second grader. You know, he was COPD. And we had little kids in like pre-K. We did infomercials in between the shows saying, please don't smoke because my dog doesn't like it, which is, you know, based on evidence-based practice. It's not good for dogs either. So we did things, it was fun. So a lot of screenings and referrals, eye referrals, and we'll talk about that in a minute. All those social determinants of health, surveillance on the population, on, you know, your neighborhood, your community might be different than another community next door. You know, what's the latest and worst thing that's going on? We have pertussis pockets in the state of Maine where people are anti-vaxxers. I mean, some of you might be anti-vaxxers. I'm not putting you down, but there are pertussis issues that crop up in school every year. I know Farmington and Ellsworth, they're big anti-vaxxer pockets, and they always get pertussis at some point in the school year, and that impacts their attendance at school. And the nurse has to be right on top of that. Just because you've been vaccinated doesn't mean you won't necessarily get it. You won't get it as badly. But we always look at quality improvement. What works now, will it work better? How can we always improve in what we're doing? Data collection, academic outcomes, like adding breakfast, you know, in the school system for people who can't afford it. Well, why not add it for everybody? You know, so it won't like oh, only those kids who are on Medicaid get to have free breakfast. It's like, why not have everybody get free breakfast? How much is that going to cost? Now, then it's not pointing out these kids that are like, oh, you're on Medicaid, you got free breakfast. But everybody gets free breakfast. It's good for everybody. So that really increased, attention span in the classroom, and the scores go up. So things like that, the school nurse is part of, because nutrition is part of school nursing too. Oral health care, I did a fluoride program. Not every school nurse does that, but it's free. Free fluoride. You have to have them get their well tested and make a statement saying I don't have too much above a certain amount in their fluoride in order to do it. But and you do things like have count the clock for 60 seconds. In first grade, that's a big deal of being able to know what a minute is, and learn how to spit and swish and spit, not swallow. So there's a lot of teaching you do. But there's a lot of research that is still being done in school nursing and quality improvement. So we do care coordination, leadership, quality improvement, and community and public health is what part of school nursing is. These are some resources that I'm going to open for you here. This is the National Association of School Nursing site, and each one of these red areas are position statements. So if you have a question, I'm not going to go through all these. Like behavioral mental health of students, that's an important thing. I never knew that these little kids can be on antipsychotics. I'm like, what? I was like dumbfounded. It's like, why are these kids on so many, antipsychotic medications? Or kids who are on or need to be on like Adderall or Ritalin, and their parents like, well, they're not. It's their responsibility to take it themselves. It's their problem. True. And it was like, well, that's probably. That their problem is they can't remember to take it. They can't focus it, but it's their problem. So you make a deal with a student. When you get off the bus, give you your Adderall when you come off the bus every day. You get another nurse, and then you have a much better day in class. So you have to look at the family and their dynamics and what's best for the student. Bullying and cyberbullying, that's big. That's really gotten a lot bigger. And I said the school nurse is usually in the middle of all of that. Sometimes with chronic illnesses, kids die. They just do because they're really, really, really ill. And then how does that work? Or people commit suicide. Middle school, I think Winthrop had like 3 suicides in 1 year. It's like, that's really devastating. So the school nurse is all part of that as well. Absenteeism, you keep track of that. Why is the student absent all the time? Or students who come to school with, it's freezing cold out, and they have no socks, or they're wearing shorts, or they're just not dressed appropriately. We had one set of students that I remember clearly. It was a 3rd grader and a 1st grader. Well, the 3rd grader was kind of taking care of his little sister and getting her dressed every morning and doing his best to get on the bus. Well, we made a home visit with the principal because it's like, geez, they don't have any clothes, they smell, It was. The mother ended up being extremely depressed. He said, well, we put the clothes down where Mom told us to put it, and it keeps on piling up because Mom was so depressed she couldn't get out of her own way to take care of the kids. So that was an intervention that we needed to do based on just the fact that, gee, these kids aren't dressed properly. Or, if someone comes in, it's like, gee, I don't want to sit next to her because she smells of urine all the time. You're like, okay, what's going on here? Well, she was being sexually abused by her father. And, wetting your pants when you're 8 years old is not usually a norm. But it is if, that's one of the signs of child abuse. So you look at those, or, we're not loud down the end of the trailer when Dad's on the computer. It's like, oh, good grief, now what, So they tell you everything, and you need to listen to them. Because usually, out of the mouth of babes is true. Usually it is true. And then when they get older, they will confide in you more than they will like their parent. Especially, if you're giving out condoms or something, then you get to have that talk with them about sexuality and about, safe sex, which maybe they never had before. So the school nurse in the middle school, in high school does do that if that's part of their protocol in school. Immunizations, we'll talk about that, but marijuana in kids, they're finding now, there's a new study that came out from Canada that marijuana is more harmful cognitively than alcohol is. They followed 13-year-olds. I'm like, 13-year-olds, they were drinking enough and having marijuana enough for them to follow, yes, for 4 years. So they followed them. It was a big study of like 3,000 kids, and they have just come out with that study. But I know the school nurses in Colorado, if you go on their blog and stuff, it's like, they were just not happy that kids were that they legalized marijuana. I don't know what your thoughts are, but you just have to look at this matter-of-factly, whether you believe in it or not, that the kids were taking their breaks and having a joint in between classes, that was affecting their school. So when it starts affecting their school and how they come in high to the classroom after lunch, was the school nurses were having a little hissy fit about that. Like, this is, how can we work with this, and make it not work. And now the vaping is another big issue with schools, because the younger kids are starting to get addicted to nicotine. Service animals in school, okay? Have a service animal and somebody's allergic to the dog in the classroom. What do? So you have to look at all that stuff. Sexuality, telehealth. Telehealth is something that we can do in school too, where they might be monitored by the physician office with their blood pressure screening every day, or whatever, or their blood sugar readings get transmitted back to the office to see if we need to change things. But these are these position statements, and it's a real great resource that's been developed. And they keep adding more and more. Like cyberbullying is new. See, that's 2018, or they amend them pretty often. So this is pretty up to date. So that's one that we always look at. There's also the Maine State Board of Education. The school nurse needs to be, they really do need to be bachelor's prepared in order to get a professional certification through the state of Maine. Nurses teachers have a professional certification. Nurses fall into that same category under the Department of Education. You have to be fingerprinted. You do same things as the teachers. So to get a professional certification as a school nurse, you have to have a bachelor's degree. If you don't have a bachelor's degree, I know Maine was a little lax and since there were a lack of school nurses, let associate degree nurses become school nurses. But they were required. They were only an associate, not a professional certificate, until they took, I think it was like 17 more credits of school, so basically moving them up into the bachelor's degree arena. So in order to get a professional, full-fledged certificate for school nursing, you do need to have your bachelor's degree. This school health manual is on the State of Maine website, and on the handout that the PowerPoint that you'll be receiving, you can go to this and figure out like what are the immunization requirements for different age groups. You also have to know your different age groups and developmental standards. So what's appropriate for which developmental age is a kindergartner in versus an 8th grader. How that progresses if they're meeting those goals. Also immunizations are different, like HPV, human papillomavirus. I don't know if you talk about that in peds or not. Those, that's a campaign that's going on right now to get kids immunized, boys and girls. And then different screenings, pests in school. I mean like lice and scabies is what they mean by pests in schools. So emergency procedures, especially a critical emergency, acute emergencies versus like major terrorism type of like school shootings and things like that, or fires, or bomb threats. That all falls in here. So that's from the state of Maine. So you have two big resources as a school nurse to fall on: the position statements from the National Association of School Nursing and the Maine State Board of Nursing, which is that one right here. Okay. Questions so far? If you have questions, just raise your hand. No? Okay, I can just keep talking. I'm passionate about this. This is a nice little chart that I found for those of you who are visual. This is home and community factors that impact health and learning per 100 U.S. students. So this tells you, all the orange ones are how many students are hungry per 100, how many students come to school hungry. That's why we have, I think your class, or one of the classes was doing a backpack program to send kids home with backpacks on the weekends. There's a nice little backpack and fill it with food, because they don't eat they may not be fed over the weekend. So they are sent home with backpacks full of food. English as a second language. They're not initially speak English. So that sets them behind to start with. The single parent household. There are lots of single parent households. See, you've got three plus lines. So majority of students have single parent households, so they don't have the support at home. So mom, or it could be dad, because we've had some dads who are single parents too, are doing the best they can. So how can the school nurse, knowing that, how can they supplement and help out with that support? The other one is parent without a high school diploma. So there are parents who are uneducated, not through high school. They do the best they can. And I found all they need to do is to be brought in, like one family in particular didn't know about, the kid had asthma, and this was actually, it was the same angry father, because one of them, there were 3 boys, and one of them had really bad asthma, and one of them was trying to open the window in the car because his father was smoking with the closed windows, and he came in and told me about it, and how, and then he came in with needing stitches in his head because his father got mad at him. It's a whole mess, but brought the mother in because it was not a single parent household, and educated her about asthma and treatment and what needed to be done and about smoking stuff, and they've really come a long way. So I know the goal of one of the oldest child was to work in the deli like mom did in Hannaford. That was his goal in life. So you talk about career and you talk about what can they be really good at, what might interest them. So you support them when you can. And these are cannot afford health care, especially with cuts in health care in kids. I don't know if the CHIP program is still, it's kind of up and down as far as health care for children. But the school nurses also puts out flyers every year about this is how you sign up for health care for your kids if you can't afford it. So they're trying to get kids to be covered by health care if nothing else. Not having a vehicle. Some kids live in houses without running water. It's very evident when they come to kindergarten, and all they do is play in the bathroom, because we had a little bathroom built in the kindergarten room. It was smart, But they were just so fascinated with running water and flushing the toilet, because they had an outhouse at their house. And that's what this is like, nowadays. They lived in a trailer. They didn't have those facilities for them, and they heated with wood, and so they were very needy. Unfortunately, one particular family decided to homeschool after their child was finding out all these cool things. So, and no house, homeless. And where'd she go? Michelle does a great job with homeless. But there are a number of students, like 2 out of every 100 you might find as a homeless. So all of these factors impact learning, and the school nurse has playing a part in that. It's like, oh gosh, how can I possibly ever be a school nurse? There's so much to know. Well, the Velveteen Rabbit puts it clearly. It doesn't happen all at once, said the skin horse. You become. It takes a long time. That's why it doesn't happen often to people who break easily, or who have sharp edges, or who have to be carefully kept. So that's you. So all of these things you're learning about, you think, I can't possibly do this. Don't feel overwhelmed by everything that's really important to know about school nursing or whatever nursing you go into. It takes time, and it's a learning process. You learn all the time. I'm still learning. I'm always out there learning and reading, and I don't know everything. That's impossible to know everything. But you just know the resources to go to, and you just keep on learning, and don't give up, because the Velveteen Rabbit says don't give up. It's a process in itself. So just to kind of summarize some of these things, the roles, these are the major roles of the school nurse: oversee school health policies and programs, provide oversight for health care, like unlicensed assistive personnel who might be in taking care of chronically ill children, or be the secretary at the front desk who's giving everybody their meds at lunchtime and answering the phone at the same time. It's like, how does that work? And putting, where do you keep controlled medications like Ritalin? That's a controlled drug. You have to keep it, locked up. And who has the keys? And how do you go all about that? So you really need to have some oversight and understand care and health education to everybody, including the teachers. Provides health care to staff and students. You want it to document. You have to document everything. If you don't document it, obviously it wasn't done. But documentation helps you to follow the students properly. And if they've transferred to another school, then that information is there. I had one student, and I had no clue that she had this condition, which I'll tell you about in a second. She was a developmentally delayed 12-year-old who was still in 4th grade, I believe. And she came in because she started her period, and she's all crying. She doesn't know, it's scary, blood everywhere. It's like, but so when I was taking care of her, I'm like, oh my gosh, this kid has herpes everywhere, in her groin. I know she's kind of itching around, in her pants, and but she had herpes, and I didn't. It's like, oh, weird. And she's been talking about her boyfriend. I'm like, okay. So you just investigate all that. And if somebody had documented that, then I found out later that, well, yeah, somebody did know that she had herpes and it was a couple years ago and it was from a sexual abuse trauma. That would have been nice to know that. But documentation is so, so important. And you can, like I know when I worked at Miranda Cook, we have a confidential part, like it's not, it's usually had to do with sexual activity. But there's, part of the record that can be read by people, and there's a part that's confidential only when need to know part. And that could have been easily put in a only need to know part, but it would have been nice to know that. So documentation is very important. Health screenings, pre-screening, yearly, and required. Like that little girl who had diabetes, it's like, yeah, I kept an eye on her weight to make sure that she was gaining weight, over the time once her insulin started to work and give her nutrition. But you look at that, and not just underweight, but overweight too. Seemed to me, and I don't have any proof of this, except for anecdotal, is that when you get into third grade, girls tend to kind of start hormonal issues. They plump out. But that's like normal. If you look at all the third graders, like they all kind of get a little chubby, when they're in third grade, and that's okay. And then they start to grow, and then they start to develop. So when does that happen? So health screenings will document that as well. But you need to do the eyes and the ears, which we'll talk about that in more depth. Referrals, you have to refer, and you have a report you have to make out to the state every year. Usually at the end of December, I have to get all of those screenings done for all your kids. It's only required to do like every other year screenings, but I always did it every year because I felt you were missing out if you didn't do it every year, especially in the early years. They don't do scoliosis screenings. Some of you may have been screened in school for scoliosis, so they found it wasn't working. It really wasn't. If you had scoliosis issues, your primary care physician would pick it up and then they could treat you. So some of them they've cut down on, but I always like to put in a little bit more screening, especially for at-risk kids, than was required. And then there's referrals that you have to make, and then you have to follow through on the referrals, which don't necessarily happen. I referred one kid home for the ear infection because I did an assessment and I had an otoscope, and yeah, she had a really bad ear infection. It was affecting her schooling. She was in 5th grade. She comes back the next day. No, she never went to the doctor. I talked to the mother. Yeah, she'll send her to the doctor. They put kerosene in her ear, which of course cleared her ear infection out because it ate right through her tympanic membrane. But that was like what Grandma always did. So there are a lot of old wives' tales that need to be like changed out there. But kerosene, I don't know, Ellie, if you remember, yeah, kerosene for lice too, head lice. Yeah, so you got to watch out for be very specific on what you mean by treatment for things. So she had like burns and everything on her ear. So that was a report I made too. But field trips, bus drivers, we have to cover everything in school. So Maine State Board of Nursing also regulates some of the school nurses' role as well. The Augusta, I think it was just last year, decided to do LPNs for school nurses. They kind of got rid of their school nurses and decided a lot cheaper to hire LPNs to be the school nurses, so they did that. Well, what can an LPN not do that an RN can do? Exactly. Christy, good job. Assessment. You cannot assess if you're an LPN. So what's the most important piece of school nursing is assessment. So they changed their tune this year. I think they've gone back to RNs, but they weren't as, okay, they could do things in skills, but they couldn't do the assessment piece and put it all together. So assessment is so important to remember. What is going to have them be successful in school and their ability to learn, if it's hearing, maybe they have earwax in their ears all the time, or even more chocolate chips, they're not going to hear well. If they don't have glasses, they can't see. You need to follow up on all of these things. You're also a first responder for accidents and first aid, so you have to kind of be up on we learn acute care in school, but we don't really learn first aid treatment. So first aid course is really kind of nice to have. What's your basic first aid? And of course, obviously, CPR. It is a public health role that you do, disease surveillance. So you have to document, like, head lice and you don't have chicken pox much anymore, but pertussis outbreaks, epidemics, endemics. So that is all shared with the state, and it's plotted through the state. Immunization compliance is also something that needs to be reported on who's being immunized, who's not. And that leads to absenteeism if they're an anti-vaxxer. They have to stay out of school until that epidemic is out. Especially even if it's chickenpox, I guess measles are coming back too. I was really sick with measles, the regular measles. I almost died when I was 7. I remember it too, so it was very ingrained in my mind. Health promotion, but we are mandatory reporters. Environmental, so when your school roof leaks and you get mold into your classroom, and kids they keep getting sick all the time, that this classroom has more illnesses, that's something the school nurse picks up. Like, why are there more people absent in this classroom than the other classrooms? Because there was mold in the wall. So then you have to close down the wall, and you have to do all. So environmental is important. Pesticides. Okay, who decided to spray pesticides on the playground? Hello, before the day school starts. Like, probably not a good idea. So let's plan pesticide spraying so it's like all gone and not a hazard to students before school starts. So these are just things that happen. Water quality. How many schools had lead in their water, had to shut down, or Legionella's disease in their water fountains? So water fountains need to be tested on a regular basis. So air quality, mold, heat, cold. So hey, we're in there for safety and health care of everybody, and holistic care. It's the needs of the family and the community. So we need to know our development, our health and safety environment. We work with actual and potential problems with students, case management, and collaborate quite a bit. This is just something I put in here. It's stats for vax.com. It's adolescent and teen vaccination, because they really want teens to be vaccinated to get meningococcal meningitis, and they have a good one out now that actually works very well, and HPV, and then have a reboot of your tetanus DPT vaccine, because diphtheria, I think tetanus was every 7 years now, and pertussis definitely, because people are not getting vaccinated, so they've lost their herd immunity to some of these things, and influenza. And when you're in community health, you probably have a debate on vaccination or not vaccination. And we usually have students who are in the anti-vaxxers for their own good reasons for that. And then the flu vaccine. Get your flu shot. It's time. October. So what is required for assessments? You want to do your height and weight, which I know you do that in pediatric lab, I believe you chart. That's what I was told. That you'll chart on the height and weight side. So you want to look for childhood obesity and also failure to thrive, which doesn't always have to be in like infants. It can be in an older student too. Know the difference, especially if you're working with 3-year-olds, length versus stature. Is it the standing chart or is it the lying down chart? So there's a difference in those two charts. And the growth charts can be found at the CDC website. And there's our hearing and vision screening rules, which I put up here if you wanted to read those. But this is your typical growth chart. You have to either have magnifying glass nowadays or not be over 45 to read these things, or wear glasses. So you need to chart it and plot it properly. And they go by percentiles, and there's a height versus weight. There's a height chart, a weight chart, and then there's a height versus weight chart. And that's the one I like the best, because that really shows you the comparison and whether they're proportional or not. And no causes for fluctuations in those charts when you see the changes in the students. So the major required assessments are vision screening. Would you guys do screenings when you were at school nurse this year? Yeah, beginning of the year, big time screenings. So you did vision screening. Eye assessment, lazy eye, amblyopia. You see if they're muscles, which cranial nerves. Which cranial nerves use muscles on the eye? Control those. 3, 4, and 6. Oh, wow. Good job. 3, 4, and 6. Terrific. I also do color vision, which I have a little screen up here for that too. So these are the major things you look at. You look at, whether eyes are centered in space or not. You can do confrontation if you feel they might have a peripheral vision problem. Usually you don't get that too much in kids. color vision, definitely you will see kids who are colorblind. And that will impact their learning too, especially if they have a teacher who likes to use colors all the time in the classroom. So you need to let the teacher know that they're blue-gray colorblind or the red-green colorblind, what kind of colorblind they are. Screenings are usually every other year. K1, 3, 5, 7, 9, 11. I did screenings because I could. You can get volunteers to come in and help you with screenings, like school nurses are really good help with screenings, but you have to make sure that they do it correctly. There's a Titmus machine, there's a box. Some of them have like sophisticated screening machines like you have at the Department of where you get driver's license, motor vehicles, where they have depth perception. Some of them do that. Yeah, I never worked in a school that had money. So we had to do this charts like that one, and we had to do the chart like this one. This one it's plastic. That goes in a good light box, which means there's a steady light behind it and lights it up. That's better than just the chart on the wall, because the chart on the wall you can get glare. But if you have it in a box that has a light behind it, you have steady light, and it's equal. So this is the one I use a lot. This is because I work with little kids. So we would go through and say, okay, tell me what that is. What is that?
Umbrella.
That's an umbrella. You might want to think that might be a tree to somebody. So if it's a tree, okay, I don't care. As long as we are in agreement that that's a tree or an umbrella, So whatever you tell me that is, it's what I decide it is. And that might be a box or it might be a house. I don't care if you can really define what the picture is. So we go through all these pictures, like that's an apple. So that's pretty much all the pictures they have on here. The best thing to do with this chart, and I thought we had some at school, but I couldn't find them. They come with cards. So you have a card that has a picture of an umbrella, and you have a card with a picture of a house on it. So if they're kind of nonverbal, they can pick out the card and show it to you when you point to like tell me what that is. They have to have their eye covered, cover one eye. Usually not with their hand, because if it's with their hand, they will squish it. You can be like a piece of cardboard you can have them put over their eye. That doesn't squish their eyeball, because then it gets blurry, and then when you switch eyes, that one's blurry because they squished it. So you want to make them be successful in whatever way they can. So they pick up that, they can just either point to that card, say, it's an umbrella, that's the same as this, they can match, or they can pick up the card and show you what it is. I don't care, as long as I understand that they know, they can see it. And that's what they decided it was. So that's the easiest way to do that. So if the kid can't be verbal and say, house, apple, umbrella, apple, they can point or they can, show you the card. So that's a nice way to do that with little kids. There's also, a lot of kids don't know their letters yet, so be careful on what you have them use. So that's why they do the pictures. There's also this one, which with hands. That one, there's also one with an E. Well, hands I think work better than an E, because then they can move their hand which way it goes, which is like usually backwards from what you're seeing, but if it points that way, it points that way. So sometimes its hand chart will work, up, down, But they have to know direction, kind of directional signals with that. So that one could be an option too. So pick the chart that fits the kid. And if you don't, then you're setting them up for failure. It's like, oh, because you didn't know the letters when you were in kindergarten. It's like, you're failing, I have to send you to the eye doctor because you can't see. Well, maybe they can see, they just didn't know the letters. And so don't set them up to failure. Make them feel good about it and make it a game that they're playing. So I know you all did this when we did assessment class. So, and remember it's a 20, you can do it at 10 foot or you can do it at 20 feet. So make sure you got it the right distance going for you, for them. So do it right and left, then do both eyes. And if they wear glasses, let them wear their glasses, because that's really how they're performing in school. We're not testing to see whether their glasses, that they need glasses. Well, if they don't wear glasses, obviously they're not going to wear glasses. But if they have glasses, test them with their glasses on, because that will make them successful. And that's what we want to know. Maybe they need another prescription if their glasses aren't working right. So that's what we're trying for. Make sure they're age specific. And practice first so that you are all understanding what the symbols mean. And usually go from top down. I usually start on the, start big and then go on the side down. I think I told you this last year. And then when they get to where they can't read it, then go up a line. And then we'll do the line to see where they are to start with. I've had some kids who were like, going right up to the chart. They really needed glasses. So, an ophthalmoscope is something that you might use. You can be skilled at doing that or not. I mean, your school may not even have one. But if you have an ophthalmoscope, you can use it. And these are just some directions on using that. I can't say I use it a lot in the school setting. But you prepare them, darken the room, look at the wall, and use a large aperture and adjust it to your own vision, just like we did in assessment class. So, and that's a picture of the ophthalmoscope, which you know about. And this will, if you do use the ophthalmoscope, these are just some of the pictures you might see. This is just a little video.
Hi, my name is Dr. Errol Zdalga. I'm a doctor at Stanford School of Medicine, a hospitalist, and also a member of the Stanford Medicine 25. The purpose of this video is to teach you the approach to looking at your patient's retina. Normally, we think of eye doctors as the ones who are looking in patients' retinas. However, if you're taking care of a patient, we want you to also be comfortable doing the same thing. So that's the purpose of this video. So let's get started. Before we can do anything else, we have to talk about the equipment. Usually we use direct ophthalmoscopes. Indirect ophthalmoscopes are the type of gear that the eye specialists wear on their head. These direct ophthalmoscopes come in a couple different forms, and two of the most common ones I'm holding in my hands. You have the traditional one here, and also the panoptic. For the purpose of this video, we're going to be mostly sticking with the panoptic because one, it's easier to use, and two, it has a greater field of view. Now, I should also mention, while we'll go over the mechanics of using the panoptic, it's essentially the same thing as this ophthalmoscope as well, and we'll talk about that in a second. Now, for the ophthalmoscope, there's three main things to know. The first one is light or brightness. So for the brightness, all you need to do is press the little button and twist it. And the more you twist it, the brighter the light will become. There's two things to remember when dealing with brightness. Number one, the brighter you make it, the more pupil constriction you may get if you're not using a dilator. And number two, the brighter it is, the more painful it'll be for the patient, so you won't be able to visualize the retina as long. The second thing to know about the ophthalmoscope is this carousel setting right here. And this carousel setting allows you to change the different types of light coming out of the scope. So the most important thing to know is this green line here. This green line will provide a medium-sized circle, which is what I recommend most people use. If you slide the green line to the right or to the left, you'll get varying sizes of that circle, a larger one or a smaller one. The purpose of that is simply if the patient's more dilated or more constricted, you can adjust the light as needed. You'll also see here a tiny slit lamp to look for variations in contour. The second thing you can also see is a blue cobalt filter. Certain scopes have that, certain come with that, and certain don't. So if yours has that, it allows you to look at abrasions on the cornea if you add a fluorescein dye. There's a green light that comes out, and that's the red-free filter. The purpose of that is to see better contrast on the red blood vessels in the back of the retina. The third and final setting to know about the panoptic is regarding these numbers here. The purpose of this third setting is to focus if you, the healthcare provider, or your patient is too nearsighted or too farsighted. This setting can actually be used to figure out what your prescription is. All you have to do is look through the scope at something about 10 to 15 feet away and move this knob until it comes in focus. And if it comes in focus a little bit towards the red setting, that's actually your prescription in diopters for someone who's nearsighted or having difficulty seeing far away. One other thing to remember is that the panoptic scope is actually very similar to the more traditional direct ophthalmoscope. This knob here correlates very well with this knob here. And this setting here that you adjust for nearsighted and farsighted is very similar to this one here. Same idea otherwise. One last thing to mention, if you're a healthcare provider and you're very nearsighted and you have to adjust this for yourself, usually you don't have to worry about the patient being nearsighted or farsighted with the panoptic. Unless they're extremely nearsighted or farsighted, you actually can set it for yourself and not touch it again. For this scope, you may have to adjust it more for the patient. That's another advantage of this scope. So before we start the demonstration, I need to make sure that this setting is adjusted for my vision. So I look at something about 10 to 15 feet away and make sure it's in focus. After that, it's very unlikely I need to touch this setting again, Unless the patient's extremely nearsighted or farsighted, you usually can set it for yourself and not have to worry about it again.
I just wanted to kind of a little review on how to use it, since you probably haven't used it over the summer. I doubt so. But you can look at that more in depth if you want to when you get the PowerPoint. You can click on that site and go there. This is what you're going to be seeing. I remember one time I did really use it was, well, I use it for head injuries all the time, but did really use it when I noticed this kid that was a good, like a soccer player, and he was like 13, I think. I noticed he kept bumping into things and kind of stumbling a little bit and like, ooh, whoops, you know. So I brought him and I looked in his eye. He had macular degeneration, which I found after, you know, talking to his parents and all, and he went to the eye doctor, that it runs in his family. So unfortunately, it's a progressive problem with him, and he eventually may lose his sight like his grandmother did, but that was something that was useful to have this on. And you can look at it for blood pressure, but you want to look at the different things. So, all right. So, but most of the time you won't be using the ophthalmoscope. So the vision, 20/20, 20/40, 20/30 is passing for grades 1 and up, because that's basically what they expect them to see, is just a 20/30, 20/40 or below for younger kids. And if there's a 10-point difference in the eyes, they don't pass. They need to be referred. Okay. And those are just the charts that we went through to show you. And then there's also a near vision chart, which you can hold like right here for near vision, which is easier to see whether or not they can read, because you're really testing for distance vision on the eye charts, not particularly near vision. Now this is a nice little color vision site that you can go to and test yourself to see if you have a problem with color vision. And I was surprised how many kids do have problems with color vision. But these are basically what you'll see on that site, where you can pick out, tell me what these numbers are in the first row. 50, yeah, okay. So if anybody couldn't read those, you will may need to look further in whether or not you have a color vision issue. But this site here, well, it's like an online test that it's kind of fun to do if you're interested. But we do that with kids too, because it does impact their vision. I could not find this. Luckily, I'd taken a picture of it a couple of years ago, but we have one of these at school, but nobody could find it. This measures eye deviation to see whether or not your eyes, you have amblyopia or weakness in one of your muscles. You put the pen light right here where I wrote, pen light here, goes through the thing and shines into your eye, and then it has a string on it to measure, make sure it's just a certain distance from your bridge of your nose and where they see the light. So, but that's a Maddox chart. You may or may not use that in the school setting. And then hearing screening. When we're testing mostly for air conduction with hearing screening and making sure that it's always nice to use an otoscope first to see if they have an ear infection or if they have stuff in their ear, like wax in their ear, before you test them for hearing, because it might be a false negative if they have wax accumulation. A lot of kids have wax and they put stuff in there. And it's like you get toys and pencil tips and all kinds of things in their ear canal, chocolate chips. That's my favorite one though. So look in first. And remember the difference between an adult and a kid about pulling up or down. Always check the good ear first, then they might let you touch the one that hurts. Because you'll have kids come in with a lot of ear infections too, and it's always nice to have an ophthalmoscope, an otoscope, to look to see if they have an infection and refer them out. So, and these are just the differences. Normal ear, we can see a nice shiny light reflex. This is with a red reflex on it. And this is obviously you have some fluid in here. You can see the pussy stuff coming out in the light. And these are tube. That's a tube. That's a good thing. They can call them different colors. My granddaughter has green ones that just fell out. My daughter's not even done paying for them, and they already fell out. But they did their job. So It's a PE tube. It's a pneumatic equalizer tube, which it equalizes the pressure. So you don't build up all kinds of stuff in it. So you might see kids with those in their ears. And once they do fall out, you do want to make sure that they healed up, that they still don't have a hole in their ear, which some kids have trouble healing them up. And this is how to do an audiometry. Make sure they don't cheat. That's the biggest thing. I've had kids who can't hear who can pass a test if you don't do it right.
Testing hearing, something that many people aren't sure about. What's involved? How long does it take? Does it hurt? And in this series of videos we're going to show now, I want to go through the variety of aspects of audiometry that enable the audiologist, the hearing aid dispenser, to make good judgments about people's hearing. The equipment that we can see on the desk at the moment is basically called an audiometer, and it comprises a number of transducers that connect with the patient. And I'll be talking to you a bit about the functioning of the audiometer in another video. But what I'd like to do is just briefly say that testing hearing is relatively simple. And in fact, the test that an adult would do would be the same test that a 3-year-old child would be expected to perform. The only difference really will be in how the patient indicates to the audiologist that they've heard the test signal. With a child, we use play audiometry. So that might mean the child putting a ball on a stick or a man in a boat each time they've heard the signal. With an adult, we have what's called a patient response button. So when they hear the signal, they indicate by pressing the button that it illuminates a light on the audiometer for the client, audiologist knows that they've actually heard the signal. So basically, once you get to the age of 3, from then on you're more or less doing the same test whether you're 330 or 300 years old. It's all a matter of how you indicate to the dispenser how you hear the signal. So testing hearing is not painful. It's quite good fun actually, and the stimulus that we use to test hearing is called a pure tone, and by that one could conclude that it's a whistle. And I can give you an example of what I mean by a pure tone coming out of the headphone. You've probably heard that very distinct pitch, and we can actually different pitches of sound across the speech frequencies are played into the client's ear, and when they hear the signal, as I indicated a minute ago, they press the patient response button. And there's a particular internationally agreed method of measuring people's hearing that all the hearing aid audiologists follow, so that we get a consistent and reliable result. One thing to remember about audiometry, using the pure tone audiometer, is that what you're actually doing is comparing your hearing, the person being tested, with internationally accepted norms. So if somebody says to you your hearing is 25 decibels, your hearing threshold, that would indicate that your hearing threshold is 25 decibels worse than normal for that particular test frequency. So don't forget, when you have your hearing tested, it's something that you can do from the age of 3 years. It compares your hearing with internationally accepted norms, and it doesn't hurt. It's quite good fun. It takes about 10 to 15 minutes to complete the test for both ears using the headphones. So that's that summary of what testing your hearing is about, and we'll go on in subsequent videos to look in more detail at different aspects of the test.
So when you do the testing, you want to make sure you have the right ear on the right ear. You know, the headphones are usually labeled, make sure they're in the right place. But make sure that the kid knows what, this is a tone, like you hear that, you know, this is what we're testing for. But then have them, some of the machines have little dials on them and they kind of click. So if they hear the click, when people, or see you click or see you turn, So you want to have them facing away, completely away from the machine so they can't see what you're doing, or else that's cheating. And I've had kids who I know had hearing issues, like hereditary, needed a trainer and the whole works, passed the silly test with somebody else when they were like kind of like peeking. It's like, oh, they're turning it. I shouldn't like push the button now, because they have done that. I mean, kids don't want to think that they can't hear. So make sure that they can't see you and they can't tell when you're turning the knob. Some of them are push button, but some of them are knobs too. And then when you flip over to the other side, some of them are, are pretty noisy. So know what they're listening for. In kids, it's really easy. Like take a block or something and put it in a bucket. When they hear it, that's easy for them. Rather than, some of them can push a button. Some of them will just keep pushing the button. So if they just don't associate button with hearing it, give them a block to throw, put in a bucket. Okay, so we're doing decibels, which are loud and soft, and frequency, high and deep. And these are the test frequencies, which you do this in order at 25 decibels. If they have, this is the passing rate, and if you have to go louder, then you document that as well, and then you refer them out. So if they don't pass at these 25 decibels at these frequencies, then that's a referral. So we talked about some of the hot issues in nursing. There's general poverty and homelessness. You were out when we talked about homelessness. You went out of the room when we talked about that. I think there was 2 in every 100 are homeless in schools. Yeah. Child abuse, physical, mental, sexual abuse. These are things that we need to be aware of. Mental health issues. Substance abuse is a problem. Allergies, diabetes. I mean, if you want to know where drugs are, just ask a high schooler. They can tell you where you get everything. I mean, it's kind of scary, but that's the way it is. Allergies. And the things that they snort and drink and take is like, oh my gosh, my eyes were wide open when I was a school nurse. I didn't know that all these household substances were something that were, abused, and they were. And cough syrup and stuff like that too. Allergies, diabetes, other chronic illnesses. They're like technology that you might need for speech and things for special needs kids, and kids can die. And how are you going to deal with the death of a classmate? Obesity, food insecurity, I think is a really big one. We're doing better at that by providing breakfast. Some schools are even providing free lunch to kids because there's so much food insecurity, and sending them home, especially in the high schools, with a backpack to take home, which looks like everybody else's backpack, full with food for the weekend. You also get eating disorders, whether it's overeating or whether it's undereating, eating disorders. Lice, scabies, caterpillars, ticks, piercings that get infected. They put piercings in all kinds of places, but they might come to the school nurse and say, well, my mother doesn't know I have this, but this really hurts. Can you or it's gooey or something, you have to look at it. Skin rashes, more common ones I see are ringworm, fifth disease. You probably learned that in pediatrics. It's the fifth childhood disease. It's a rash and stuff, which you can't be, if you're pregnant, you can't be around that. Impetigo, which is a staph infection, and a lot of times it's on mouth area, scaly and scabby and gooey. It can be on the knee, it can be anywhere. Eczema, poison ivy. People are allergic to poison ivy, that just takes off. If you see someone poison ivy, and it just spreads quickly if they're allergic to it. Sexuality is an issue, especially as they get older. Education, birth control, suicide prevention, and depression. Unfortunately, too rampant in our school systems. Terrorism, disaster planning, environmental issues. Who would think you'd have to do, even the building? Yes, you do. Bullying and cyberbullying, and vaccinations. These are I think some of the most common things that you'll be dealing with as a school nurse. There is a policy on bullying and cyberbullying. Includes the prevention of bullying. I did a Bully Proof Your School program when I was there. Identification of students who are bullied, who bully others, or both. And you have a real good leadership role in implementation of bully prevention strategies and policies in the school system. So we're not going to do this, but okay, so we'll go back to that in a second. But nurses do research. There is a national school health data set where every student counts. So every student that we report on counts towards the data set. Data increases knowledge and changes attitude, and reform can be accomplished only when attitudes are changed. And as you will find out in 301, and you will know this already, that Lillian Wald is the founder of school nursing. So if you want in your history. So I just wanted to mention a little bit about bullying. I do a class on civility, and this is just a really teeny tiny part of it, but this is like treating people as people rather than objects. So if you take a chair, for example, chair is an object, right? We'll all agree on that. But a lot of kids feel that they are also treated as objects, and maybe you feel that way too. So you can, as an object, you can be used to sit on, to stand on. You're being used as an object. You might feel that way, that you're being used as an object. Somebody's using you because you take good notes, but they're not your friend. But you know, they use you for that. Or as an object, I could like just kick this chair out of the way and just like ignore it. It's not even there. It's in the room. Yeah, it's in the room. It's an object, but it's an object, and it's not even. I don't really care about that. Or I can use it and really include this object in my world. And it's like, oh, it's a nice chair, nice person. I'm going to include you. So really look at how the students are treating each other. Are they treating them as objects, or are they treating them as people? And that's really the core of bullying. How are they being treated? And many times I'll do a program that I do. It's based on the Arbinger Institute that I'm a trainer for. But it's like Anatomy of Peace is one of the books, and Outward Mindset is another book, or Leadership and Self-Deception. Those are really good books on how people act because of the way they're treated or expected to act. Like, I'm the victim, so I need to act this way to be like the victim all the time, or I'm better than you, so therefore I'm going to treat you like this because that's the way I want to be seen in life. When you see that in the school system too. So take a look at yourself and your families and your kids, and are they treating each other as people to be inclusive, or are they treating others as objects, either being used or discarded as an object? When I did this in a healthcare setting, I have lists of how, it was sad, how people are treated, felt that they've been treated as an object, or not even given the time of day, or not even able to voice their opinion, just kind of discarded, in that way. So that happens all the time in our society, unfortunately, and it's rampant in the school systems. And then you get into cyberbullying, and that's a whole different story too. So, what questions do you have about school nursing? Are you ready to go to be a school nurse now? Remember, the Velveteen Rabbit said it takes time. It takes time to develop all this, and you just don't, can't have sharp edges or be too fragile, and you will be successful as a school nurse.